remaining silent in the face of suffering. Today, 27 gas turbines are illegally operating right now in DeSoto County. That's a fact. They don't have a permit for those 27. They've now just been given a permit for 41. They illegally operated gas turbines here in Memphis for over a year, from June 2024 to July 2025. And you know who confirmed what we already knew to be true? Donald Trump's Environmental Protection Agency. While we were being sent propaganda, telling us that our complaints weren't real, while we were being told that all we were doing is screaming and making noise and looking for clout and attention by the mayors, the Trump EPA said, you know what, they were right. Elon Musk illegally polluted their community for over a year with more pollution, double the pollution, than the Memphis International Airport. We have a real problem. We are going to have to be educated, informed, and activated to change this. With that, I'm going to pass it over to the one and only, well, first, forgive me, let me give my thanksgivings to my amazing team, my amazing wife, O'Shea Argillian, and Daphne Thomas, our communications director, Alicia Ward, Allison Wade, Michael Short, Pearson, who are greet people as they come in, and to each and every one of you, let me just say thank you. You could be doing so many other things with your time, but you are here, and our presence is power. So whether this is your first meeting, or you stop counting how many meetings you did come to over the last 6 years, I am extraordinarily grateful. And with that, I'm going to pass it over to Dr. Michael Cork. Give him a round of applause. And he just got to Memphis this morning, so give him a real welcome to Memphis. Round of applause.
Thank you all for the warm welcome. I did just fly to Memphis today. It's beautiful to be in 70-degree weather instead of 30-degree weather in Cambridge, Massachusetts. I'm also really thankful to Representative Jessica Pearson for having me here to share the work that I've done on understanding some of the air quality, health, and economic impacts of this MDEQ tech facility, which is the gas proposal that's going to power the Colossus 2 data center for xAI. My name is Dr. Michael Cork, and I want to start by just giving you a little overview of who I am and who wrote this analysis to kind of hopefully convince you why it's important to listen to this. So I am a health scientist at Harvard School of Public Health. I hold a PhD in biostatistics from Harvard and a master's in public health from the University of Washington. The work that I've done throughout my dissertation was trying to link the effects of air pollution, exposure to air pollution, to health outcomes. And this is one example of showing why this is really important. This work was also done with Francesca Dominici, who is a professor at Harvard and also the director of the Harvard Data Science Initiative. She's been over 3 decades doing work in air pollution, and she's actually one of the main reasons her work has been cited a lot around setting a national ambient air quality limit, or setting the national limit of what is allowable for fine particulate matter. So our lab has a lot of expertise studying the health impacts of air pollution. And these methods that I'm going to present are similar to methods that are used by public health agencies like the EPA and WHO to set what we consider to be a reasonable limit on these pollutants. Okay, so this is based on work that I did actually with the Southern Environmental Law Center. And what I did was create a report. And what this report looked to do was, at the time it proposed, a 1.2 gigawatt power plant that is going to power the xAI data center that's being built in Southaven, so DeSoto County, Mississippi. To my knowledge, up until our report, there had not been any concerted effort to understand the impacts of this plant in terms of air pollution and health. And what we looked to do was estimate how the plant would affect fine particulate matter exposure, which is a specific type of air pollution that I'm going to talk a little bit more about, the health effects, and the economic damages on the community. So first I want to step back and give a little bit of an introduction of what type of pollution that I'm studying. So throughout this presentation, I'm going to talk about fine particulate matter, or PM 2.5. So the 2.5 in PM 2.5 actually refers to a specific size, 2.5 microns, which is a really small size. To give you a context of how small this is, it's actually 30 times smaller than the width of a human hair. So if you take a piece of human hair and you were to cut it, hold it up to you, you'd have to cut 30 times width-wise, and that's how small and tiny these particles are. The reason that's dangerous is that these tiny particles are able to penetrate deep into the lungs and can actually enter the bloodstream. So their size is one of the reasons that it's tied to a lot of different health effects. And fine particulate matter actually comes from a variety of sources. The figure that I have on the right, I like because it shows that this is not just from power plants, it's also our automotive industry, aviation industry, lots of different forms of combustion lead to fine particulate matter that is in the air. Large-scale scientific studies have shown that over 90% of the health risks from air pollution come from PM2.5. So when you're talking about air pollution and health, it's really important to focus on this type of pollution. And the scientific literature is very detailed on understanding its impacts, and it's been linked to impacts on a lot of different health outcomes, including heart attacks, strokes, asthma, lung disease, and premature death. One thing that's really important to emphasize throughout this talk is that there is no, quote, safe level of fine particulate matter exposure. What we do at a national level is we set different limits. So there is a national limit set by the National Ambient Air Quality Standards, but even in areas that meet these federal standards, it's important to note that if you increase the fine particulate matter in an area, you're going to through this is MDEQ, which lists the maximum amount of pollution levels that are allowable under this air permit. And that's in terms of primary PM2.5 pollution and also other criteria pollutants. The second thing is we need to understand once the pollution leaves the plant, where is it going to travel? So we use a peer-reviewed method, a dispersion model, to simulate how these emissions would travel through the air and affect nearby communities. One thing you're going to learn about this is air pollution does not respect borders. Air pollution can travel pretty far from the source, and so it's really important to understand where this air pollution is going to travel, especially when you're considering building a new power infrastructure. The third thing we wanted to do is once we understand where the pollution is going to travel, we want to determine who is going to be exposed. Who are the people that are going to be breathing in this pollution, and how are they maybe different than the general population? Where is this burden going to be concentrated? Finally, we use the EPA, US EPA tool to estimate how many additional illnesses, premature deaths, and the associated economic costs and damages would be from this proposed plan. So I'm going to from there jump into some of the results, and I'm going to show a couple of different maps. Okay, the first map that I'm going to show is looking at the regional distribution of fine particulate matter, and this is, I'm going to first start pretty zoomed out and then zoom back in. So as you can see here, we're looking at this tri-state area. We have Arkansas, Tennessee, and Mississippi. The location of the plant is actually harder to see here, but it's a blue dot in DeSoto County. It's near the border of Shelby County. And what you can see here is I'm actually plotting all of the census tracts, and each census tract is colored by how much additional pollution is going to reach that area. So the darker red corresponds to more pollution. So you can see that the pollution is going to be concentrated near the plant in DeSoto and Shelby County. I'm going to zoom in a little bit more. So the blue dot maybe is slightly more visible here, but again, what I'm showing is that the pollution at the census tract level is going to be concentrated in DeSoto and Shelby County. Now, one question we get a lot as air pollution, when we work on air pollution methodology, is how do I understand the risk, right? What does it mean? How bad is this pollution, right? So what you can see from here is I'm saying the darker red corresponds to more pollution, but we need to understand how we can translate that into something that maybe we have a little bit more intuition behind. So what I've done here is, on the bottom of this graph, you can see that I have a scale, and it goes from kind of yellow, which is at 0, and dark red is near 0.8. And then I have a measure of concentration, micrograms per meter cubed. You don't have to understand what this concentration means, but you can think about it as, how much of this pollution is going to fill up a cube. And when we think about health, one thing that we can do is think about how this risk translates to other risks. So if a community has an increase of about 0.15 micrograms per meter cubed, if you look, that's around this kind of orange color, that translates, using science, that is linked to about 1 additional death per 100,000 people per year. That's similar in scale to the average annual risk of death from influenza in the United States. A long-term increase of about 0.5, which you can see on this scale is kind of right in the middle, which is kind of trending towards this red color, is linked with about 3 additional deaths per 100,000 people per year. Now that's similar in scale to the average annual risk of death from alcohol-impaired driving nationwide. So what I'm saying here is if you are in a community that's going to have an increase of 0.5 or greater, that is similar in magnitude to adding the risk of drunk driving to the mortality risk of that community. And one thing that's really important to note here is that I'm not saying that I can tell you which individuals might die from air pollution. That's not how population health risk works. But what I'm saying is at a population level, this risk translates to a risk that we would be able to see at a larger community level. It also translates, I like the anchoring it into something that we have a little bit of intuition behind, like drunk driving risk, because we know that at a community level, we often make policy that is designed to mitigate some of these risks. Okay, now I'm going to change from, I was before showing census tracts, and I apologize, this figure is going to be a little harder to read, but I'm going to quickly change to a slightly more zoomed in version. But what I'm showing here is all the towns and communities in the area that are going to be affected by the plant. And what I'm plotting here is each different town is, again, the color corresponds to how much additional pollution is going to reach that town. But given that a lot of you are probably from the Memphis area, I'm actually going to zoom into this plot, which is showing the most affected region or towns from this plant. What I've shown here is for Memphis, given that it's such a large city, I wanted to not just average it out across the whole city, but actually go into these Memphis 3.0 planning districts, which roughly correspond to different neighborhoods in the area. And one thing to note here is, again, this blue dot, which is in DeSoto County, is the location of the plant. You can see, though, that the highest red are going to be also in areas of Memphis, right? We have Whitehaven and Westwood as really highly impacted areas, as well as Horn Lake and Southaven in Mississippi. So again, this is showing that air pollution travels. It does not respect any state borders, and it is going to, depending on where you live, have different risks. What I showed before, which was a map, I'm now showing as a table. So this is showing the top 10 areas or towns or subdivisions of Memphis that are going to be impacted by this additional pollution from this plant. At the top of this, right, we see that actually Whitehaven in Memphis has the highest estimated increase in fine particulate matter at 0.588. Then we have Horn Lake. We have a couple of different areas of Memphis that are included in this top 10 list. So this is just conveying that information that was before in a figure, now in a table. What you can also see is that I've included the population, because when we think about risk, it's really important to think about where people live. And so you can see that the areas of Memphis are often higher population areas. Kind of continuing this trend of thinking about population, I have this table that looks at a measure in public health we call exposure burden. What's important about exposure burden is we don't actually just care about where pollution levels are high, we care about where are people living that will be breathing in these high levels of air pollution. So we have a measure called exposure burden that's a combination of both where pollution levels are high and where a lot of people live. And this kind of gets to a different view of risk. And when you look at that view of risk, it actually turns out that Shelby County is going to have the majority, or over 50%, on 63% of the total exposure burden from this plant. So that is saying that Shelby County isn't necessarily the county that has the highest increase in absolute and fine particulate matter, which that would be DeSoto County, but because so many more people live in Shelby County, there's going to be a lot more people who will be breathing in that level of pollution. And so I think that's a really important measure to focus on, especially given that this decision is happening in Mississippi, but would have large effects in Shelby County. Okay, so finally I also want to talk about who is going to be impacted by these pollution levels. So this table is a lot to look at, but I want to actually explain it verbally first, which is we looked at all the areas that are impacted. We wanted to understand what do they look like in terms of poverty rate, percentage white, black, Hispanic, Asian, how many people age 65 plus, median household income, median property values. We want to get a picture of the people who are most impacted by this pollution. How might they be different than kind of your average resident of the United States or average resident of Tennessee or Memphis? And what I'm showing here is different cutoffs. So the columns correspond to all the census tracts that are above a certain cutoff of pollution. And each time I start at 0.01, I go to 0.1, and then I go to 0.5. It's a higher threshold. So we're kind of zooming in on the areas that are most impacted by this pollution. So I want to really focus on that column that is highlighted here, which is above 0.5 micrograms per meter cubed. These are the residents that are going to be most impacted by the plant proportionally. And there are 89,000 people living in census tracts where we estimate this increase is going to be above 0.5. And I'm actually comparing it here to the Mississippi average, but there's a couple things that stand out. One that I've highlighted is that 73% of residents who are living in these high census tracts are black, compared to the average in Mississippi, which is 37.2. So we see there's an overrepresented representation of black communities that are going to be receiving this air pollution. I also want to look at SVI, which is Social Vulnerability Index. This is a measure that is often used in the scientific literature to measure how susceptible is a community to different stressors. This is a combination of socioeconomic factors as well as other factors that are important when we think about how many resources a community has access to. What I want to emphasize here is that the communities that are impacted by this pollution have much higher social vulnerability than the average. So 75.8, the higher the SVI score, and it goes from 0 to 100, the more vulnerable. And so what this is saying is these communities actually have higher social vulnerability than the average. And finally, I want to also look at adult asthma prevalence. We know that there are certain higher risk groups for air pollution, including those who have asthma. And we see that in the highest impacted communities, right, there's a higher adult asthma prevalence of 12.6, which is higher than the average, the national average, or the Mississippi average of 10.5. So what this story is saying is that the areas that are going to be most impacted are areas that have higher social vulnerability, are larger proportion of black residents, and have higher adult asthma prevalence than kind of the average in Mississippi. Okay, I want to then talk about health damages. This is one of the, I think, salient results from this study, which is we use an EPA tool where we can look at where the pollution is going to travel and how much we think it's going to contribute to a bunch of different health endpoints, including premature deaths. So one of the really important aspects of this study is that we think that this plant is could result in 1.9 to 2.9 additional deaths across the entire impacted region. It also would lead to 9.6 new cases of asthma onset, 1,500 cases of asthma symptoms, 1 non-fatal heart attack. And so what this does is it gives us an order of magnitude estimate of what the impact would be. And this is going to translate to $30 to $44 million in health damages. One thing that I always emphasize is I think one of the main questions is also that's a large range, right? 30 to 44. The reason this range exists is that the Environmental Protection Agency actually has 2 different estimates it uses for linking air pollution to health or to premature death. So this is standard practice at the agency to understand what the potential impacts could be. So, and again, one thing I want to emphasize, this is per year. So we're looking at $30 to $44 million in health damages per year, which depending on the lifetime of the plant could translate to pretty large impacts in terms of deaths, premature deaths in the community, and also to estimate the health costs or health damages. And to really kind of show that point, what I'm showing here is based on different assumed operating life cycles of 20, 30, or 40 years, we can translate that into different costs, which could total, if it's 30 years, it could total between $900 million and $1.3 billion in health damages. Okay, so I want to end the talk by giving a couple of high-level takeaways from this report. And the first that I hope that I can communicate to you is that fine particulate pollution, or PM2.5, is one of the main health risks from power plant emissions. There's no, quote, safe level of exposure, so even at concentrations below the federal standard, we would see impacts on health. Another thing I want to emphasize here is that there's areas of the place that are most impacted, right? Areas of DeSoto County, area of Shelby County. These are areas that are already at relatively high background levels of air pollution. So when we think about attainment of the National Ambient Air Quality Standards, which is set at 9 micrograms per meter cubed, there's already evidence provided by the EPA that Memphis is already above that. Or it is, in 2023, there's estimated to be above 9 micrograms per meter cubed. So these are already impacting areas that are relatively high levels of air pollution. So that's another important context for this study. The second point is kind of re-emphasizing that, which is the project would have pollution in a region already facing elevated health burdens. These impacts fall in communities already near or above air quality standards, and also on vulnerable neighborhoods that have higher levels of social vulnerability, have higher levels of asthma prevalence. And then the final conclusion is that the health damages are large and long-lasting. Based on this EPA model, we estimate that it's going to cost $30 to $44 million per year in health damages, which could translate to $600 to $860 million over 30 years. So thank you all for listening, and as the representative said, I will be able to send this information out, and the report is also available online if you want to find more details, and I'm really happy to take more questions too. Thank you.
Please give Dr. Parker another round of applause. $30 to $44 million a year. One of the really important things, research is just so powerful, and this research is based entirely on what xAI presented, right? Like this is their data, this is their information that has been translated to what the consequences would likely be for our community, okay? You all know the Southern Environmental Law Center has done a lot of good work with us for many years. One of the things that we sent in the request to the Mississippi Department of Environmental Quality was a question about how much particulate matter 2.5 was actually listed in the research, in their permit application. In their permit application, which was used by these amazing Harvard researchers, they said there's only going to be an increase of 19.5 tons of particulate matter 2.5. And so that's what the consequences of 19.5 tons of particulate matter 2.5 a year would be. Here's the challenge. The Tennessee Valley Authority, which produces 800 megawatts of power, produces 315 tons of particulate matter 2.5. So let's put it like this. You have 800 batteries. They put out 315 tons of particulate matter 2.5, which Dr. Corky has explained to us is already dangerous. This company is seeking to put out 1,200 batteries. But they're saying it's only going to put out 19.5 tons of particulate matter 2.5. So what's more likely is over 300 tons of particulate matter 2.5 will be produced by this company, which would mean this is an extremely conservative estimate of the consequences. And they were allowed to put 19.5 tons inside of their permit application. The Mississippi Department of Environmental Quality didn't ask them for more information, didn't say, hey, that doesn't seem possible because there's a plant right next to you that's producing a whole lot less power, but they're producing over 10 times as much, particularly 2.5. But they were doing this in a very sneakily way, quickly done. And we said, all right, Southern Environmental Law Center, Dr. Court, they said, we're just going to take what they said and look at these consequences at 19.5. So if it's more realistic that it's 300 tons of particulate matter, 2.5, these numbers increase by over 10 times. Likely. Hundreds of millions a year. Likely dozens of people prematurely dying a year from this pollution. And the Mississippi Department of Environmental Quality did not force them to go back and tell the truth on their permit application. So this is bad enough if it was 19.5, but we have many reasons to believe it's actually going to be much higher than this. A couple of things for us. One, we have to demand and ask questions of the people who represent us. Where's your city councilor? Where's your county commissioner? Where's your mayor? And some of us got two. Where are both your mayors? Because this is real. And as Dr. Cork said, it's no telling who baby it is or who grandmama it is that's going to get sick. You don't know if it's going to be in Southaven, if it's going to be in Westwood or Arlington. You don't know where. But we do know that this is real. And what we have to do, the responsibility we have right now, is to demand that the people who represent us say something. Because a lot of them have went quiet. A lot who have a whole lot to say for a whole long time. Right? Press op-eds, was in front of TV cameras, now you can't find them. We need to put pressure. And so when we send this presentation out, we're going to send you numbers for every city councilor and county commissioner too. And all you're asking is what you're doing about this. What you're doing about this. Because this price doesn't get paid by the government. We pay this. Those with our lives, like O'Shea said, right, these are the hospital visits. Right, these are the doctor's visits. These are the days missing work because you're taking your kid to the hospital for respiratory challenges. And to your point, right, and we already deal with this very significantly. But what's SVI stand for again? Social Vulnerability Index. And the other side where it says the SVI for our community, and there you go. At the bottom here, where you see it's at 75.8 for communities that are in the 0.5 per cubic squares. Like our community already suffering. We really can't take more. But it's been forced upon us by elected officials and the richest man in the world getting together behind closed doors to do this to us in Memphis and in Mississippi. Mayor Musselwhite, Mayor Young, and Invisible Mayor Lee Harris, right? Like they have colluded for this to happen. So I just want us to be eyes wide open, because I go some places and people say, why are you making all that noise? And why you always got to be saying something? Why you always the one? Right? But I'm saying, I appreciate that from my family, but I'm talking about other people in the community. The people y'all go to church with, who say, why he always making noise? Why can't he just go along to get along? Why he always calling out people? Because we family, and I'm at church because this is Dr. Hunt church. I mean, that's my family. I can say what I want to say here. And because White Haven, 99.99% black, African American, I can also say what I want. We got to hold our people accountable. Because this city is majority Democratic, is majority black. But today we wonder where our elected officials are in fighting for our lives. I'm not talking about fighting for tax money or titles or positions. Y'all, we in a fight to be alive. And not only are we losing, our people helping us to suffer more. They're helping us to suffer more. The people who, exactly, they got the titles, the positions, but people who don't feel accountable to us will do things like this. And they tell us that smell, y'all smell, that's not a real problem. We got told the tax money that we're going to get is more important than our lives. And I'm going to wrap here. I'm going to take more questions you have. Come on, Dr. Gordon. But if you count up the tax money that we'll get annually, it will always be substantially less than the consequences of the health-related damages from the plant. Just realize that. All the tax money that's coming in is always going to be less than the economic damages that we experience. And who is the we? I'm so glad you asked. 73% of the people who are going to be exposed by the population level are black folk. Our community has per capita income around $39,000. Poor black folk are the ones who are going to carry the burden of the billion-dollar corporation being able to continue to pollute our community. Always have. But the question is, what we going to do about it? Some folk have been marching a long time, speaking a long time, I fight a long time, but it's going to require all of us to ask the hard question. Councilman, councilwoman, mayor, what you going to do about the consequences of the loss of our health? Because we went to Mississippi. I was the only elected representative from Tennessee there. And still the only one here. We sent this out to everybody. Yo, we have a real problem. And we have a real problem with people who are power. All right, Dr. Court's going to take your questions. Y'all know I just drove in from Nashville, and then my wife forced me to go to the dentist. And we have a concert tonight at 8 o'clock. I haven't had a date in 6 months because I'm running for Congress. We're going on our date. So we're going to get out of here at 7:30 at the latest. And we're going to do 20 good minutes of Q&A. Come on, Dr. Court. I'm coming, Auntie.
Situation and just stop talking about it. So you can fix your mouth
So we have information, and it is now our responsibility to what Ms. Rice said, is to use it. And the accountability of the people who represent us, this is their job. People get mad because I think this is my job. The question is, why is it just one elected official who thinks this is their job? Because other people have got complicit because we held them to account all the time. We failed, so we just go ahead and talk. So when you get the numbers, it is the responsibility of elected officials to have a plan. Yes, our community has an action plan. Yes, we are doing air monitoring. In April, we're going to have a huge meeting to let you all know the results of that project. I want to thank people across 319 in Boxtown who allowed us to study the air, and it's pretty hard results about what's happening. So we are working it simultaneously. Let's hold them accountable. Don't let nobody off the hook. Nobody off the hook. Ask them, what is your plan to improve the quality of our community? What is your plan? And don't let them go when they say, well, I introduced a bill. That ain't enough. Right? That's not enough. We have to put more pressure on them to fight and to advocate for us. From our Congress vote to our city council and county commission vote. Let's get a couple more questions.
My name is I'm a member of Fox Neighborhood Association right here in Bucking. What I don't understand is, how in the world could these people come in here, put a grant in, not come in and answer questions, or to an answer, to let us know what they were going to do, and how it was going to affect our community?
That's a great question. We're on a tag team. Can you talk about where we got the research from, or what they submitted? Then I'll talk about the process.
Yeah, I'd love to. So what was submitted, or where this research stems from, is the air permit that was, right, in this air permit they have to list how many pollutants are going to leave the plant. What we did, and I think this is where I think a lot of these questions are going towards, which is the hard part of how do we translate into understanding where that pollution is going to actually go and who's going to be affected and how that's going to translate into health outcomes. And I personally believe that data is really important and should be available to communities that are going to agree or to install a plant in their, near them. And I think that's something that this sort of information and data should be made available when we have a new plant that's being proposed. That currently isn't, anything that's in the law, but that's what we did here. Is we took what they have in the permit and then we used the latest science and what is agreed upon in peer-reviewed literature to translate that into the health impacts.
The sort of political side of this thing, they had to submit a permit, which they did more quickly this time because of what happened in Memphis, because of the advocacy work that we had to do. So they did apply for the permit through Mississippi Department of Environmental Quality. After the Mississippi Department of Environmental Quality sent them a letter allowing them to illegally pollute against the Clean Air Act using Mississippi statutes, they applied for a permit. A hearing was held for the permit. 300 people showed up. Everyone who spoke was in opposition to the permit. A couple of weeks later, which was 2 Saturdays ago, they responded to our comments. They responded on a Saturday, and they had a final meeting the following Tuesday. And so we had about 5 days, and the responses were not adequate. They did not have research in them. They did not have science. They were not science-based. And they went into executive session, as Keyshawn and some other folks we had. When they went into executive session, which was privately, they made a decision, and then they just let us know we decided to grant them a permit. We are seeing the failure of our democratic institutions, lowercase d. The entities that are supposed to protect us are not protecting us. The Shelby County Health Department did not protect us. Now the Mississippi Department of Environmental Quality has not protected us. And it isn't because people haven't shown up. It's that we have mayors and these departments that are supporting what this billionaire wants to do at all costs, regardless of the impacts to us. Exactly, because they say we need the tax money. And look how great this project is. It's billions of dollars of investment. And that's the last thing that's coming your way. There are now billions of dollars of investment coming into our communities. The machines cost billions of dollars. That does not mean we are getting billions of dollars. Would you feel it if we were getting billions of dollars? That's not what's happening. And so it's sobering, the fact, but literally, like, we are being failed in a very real way. And there are very, very, very few people who are willing to stand up, organize, and mobilize people to understand the information and to fight back. I'm coming over to the point.
Okay, so we just heard news that there's going to be a new building built on 2 miles. Some kind of 3-story, another day or two. So right now, we have no idea what's going to be required for that city. If there's going to be turbine, if there's going to be another water treatment, we don't know. So we're trying to figure out where on 2 miles. Is it close to John P. Freeman? Is it close to the Mississippi? We don't know. So I represent 7 schools in the area, and the parents are just concerned. So,
Again, not to be the sobering person, I'm just being real with y'all. The plant already a mile away from John P. Freeman. The 41 gas turbines, a mile away from John P. Freeman. And exactly, I go home road. And we got any Mississippi folks here? You talk about the South. So we got a number of pieces of pollution, but do it in a whole good minute. Tell people about what's happening as it relates to the Safe and Sound Coalition and the noise pollution for folks in Southaven.
Yeah, so yeah, I live in Southaven, Mississippi, half mile, just measuring a straight line from the power plant. I hear that noise 24/7. Anytime I'm home, I hear it. Inside my house, I hear it. There's a feeling to it also. I've been pretty outspoken with our mayor and everyone. He just writes his office with the charters and all this. And I finally feel like it's time to start taking the noise serious, but nothing's changed. They spent $7 million on a sound wall, didn't know. So they're trying to further mitigate the noise, but this is stuff that I've asked from September or August when the noise started. It's like, what are we going to do about this noise? Well, we're working on it. It takes time. It will be better next week, and I assure you it's going to be better. I said that there's a high pitch and a low tone that I'm hearing all the time. It's endless.
I first realized the noise situation. So we obviously super concerned about the air pollution. Our closest houses are about a mile away from the one that's right off of Paul Lowry Road. But on TikTok, you can actually listen to a lot of the recordings. It's literally like the jet engines are running 24/7. You're 0.5 miles away, some folks are 0.2 miles away. So there's noise pollution, in addition to air pollution, and there's a concern about water. The scale that they're going to be able to have for even if it's 1.2 gigawatts of power, we assume is going to be used to also power what I call Colossus 3, but they're probably not or something. And so these 41 gas turbines, we believe are going to be a part of that, with the possibility that they can go back to the Mississippi Department of Environmental Quality and say, we need some more. And they say these are the cleanest turbines ever. And there was a guy, which they snatched it on Instagram, but we were like, because he was asked, do you want to live by there? He's like, oh, no, I never want to live there. I live far away. Right? He said it's an industrial park. And it's like, well, we live right next to that. Right? And so the parents should be extremely concerned. And you know what? It's time for them to call up their elected officials, like we talked about, and say, what are you doing to help us? Exactly. Because that's one of the consequences, right? Of being 2.5, the increase in asthma. You can say some more, like, I have so much fun.
No, I think these are all really great questions. And this is something I want to add to my talk, is there's a lot of impacts on the environment and health that can come from a power plant. We're focusing on air pollution, and hopefully I can see why it's really important to look at, but thinking about noise pollution, thinking about the water consumption, thinking about other forms of pollutants that aren't just PM2.5, but also important considerations when you're thinking about the impacts.
Hello, my name is Amber. I'm a PhD candidate right here at the University of Memphis. And I'm really fascinated about the research, and I'm hoping that you will also tag team on this question. I know, and this kind of alludes to what you were just mentioning about other types of pollutants, because I know that the SCLC mentioned that there is also a lot of power that's being emitted to essentially power moving turbines. So my question for you is, will your research continue to look at not just air pollutants, but will it look at water, and will it also look at electricity? Because we also know how volatile MLGW is here, and at the spike of every single change in season and things of that nature, us black folks, especially folks that are lower income, are paying the price for these $200 and $100 bills that usually during normal seasons are anywhere between $90 to $95. So in conclusion, what say ye about being able to look at other types of pollutants and how these things are going to continue to be a divestment to black communities in Memphis?
That's another great question. I'm going to take a stab at this because I feel very passionately about that we need, this data is powerful, right? We've seen that. The data that we need is independent science-based data to understand the impacts of these massive infrastructure changes that are being done to power the AI transition. And that's something that me as a researcher, I feel really passionate about, and also as a lab we're focusing on. We started air pollution because this is something that we have a ton of expertise on, and I think it's a really straightforward. There's a lot of scientific evidence that we can link to show how pollution is going to travel and how it's going to affect people, and we know that that's really linked to a lot of adverse health outcomes. So looking at air pollution as a first pass of one of the impacts is important, and that's why this focus on air pollution. You have a really important point, which is it's not just air pollution, right? We know that it's going to have impacts on water consumption in communities. We know on electricity pricing, right? And this, so these are all areas that actually I'm currently, and I know a lot of other people in my lab and also across the country are trying to get hands on, is get enough data to try to understand these impacts holistically. Because my belief is without the data and information, we cannot make an informed decision about how we want to proceed forward. And this data and information is something that our communities and public deserve to have.